but for those of you who don't know me, my name is Elizabeth Diverkstein-Bose, and I'm the social worker with the Airways of Hope program with Lung Cancer Canada. And today I'm joining from Treaty 1 territory, which are the lands of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and also the homeland of the Métis Nation. This webinar today, Managing Lung Cancer-Related Symptoms and Side Effects, is a webinar that's a part of our Airways of Hope educational series. And other webinars that we've done a handful of them so far. They can all be found on the Lung Cancer Canada website under resources and then videos. So as you may have seen that message pop up on your screen about recording this presentation, the first part of the presentation will be recorded today and then also posted on the Lung Cancer Canada website as a resource that can be accessed at any time. But then once the presentation portion is done, we'll stop the recording and then we'll be able to have a confidential question and discussion period in the second part of the hour today. Oops, let's see here. There we go. So the goal of this presentation today about managing lung cancer symptoms and treatment side effects is really to identify strategies to better manage those symptoms and side effects, really with the overall goal to improve health and quality of life. So we'll briefly explore the impact of lung cancer, and then we'll highlight some common symptoms and side effects, and then we'll discuss strategies to manage those symptoms and side effects. Oops. So just a brief disclaimer before we get started as well. This presentation was prepared by me and really provided through my lens as a social worker. So we recommend always that people living with lung cancer seek assistance from other healthcare professionals, including, your healthcare teams like your oncologists, nurses, pain and symptom management clinics, pharmacy teams, and then other members, trusted members of your healthcare team as well. And always, again, as a reminder that if anything comes up from today's conversation, questions or concerns that you might have, again, please speak with your healthcare team, and also feel free to reach out to my colleague Michelle and myself as well at Lung Cancer Canada if you'd like some additional support following the presentation today. So, when we think about lung cancer and everything that brings with, from diagnosis to treatment to living with advanced disease, lung cancer, as you know, no doubt, is a very complex and challenging disease to live with that really impacts all parts of life. And research tells us that people living with lung cancer experience greater symptom burden and psychosocial distress than those with other types of cancer. And we also know from research that inaccurate perceptions of those symptoms can actually negatively impact patient-centered care and quality of life. So what I mean by that is that sometimes, symptoms are overlooked or they're downplayed or even dismissed altogether. And sometimes it's, hard to know what's what. Is it a symptom related to disease or to treatment or to both, or maybe neither of those? Maybe it's related to something completely unrelated to cancer. And sometimes it's, kind of confusing to know who to talk to about those symptoms and side effects that are coming up if you don't know where it's coming from. So is your oncologist the best person to talk to? Is it the GP or someone else? So sometimes managing symptoms can result in even pausing treatment, which, is a difficult decision to make and can be a complex one to think about. So being informed is one of the most important steps in managing your or your loved one's care. The more you know about lung cancer and its impact on health and well-being, including, the side effects and symptoms that we're talking about today, the easier it'll be to determine the best treatment plan and path for you moving forward. Again, lung cancer, this is not new news. Lung cancer impacts all parts of life: physical health, mental and emotional health. It impacts relationships, and it also impacts day-to-day life, including work and finances and other practical matters. So whether you're on active treatment or not, living with lung cancer can feel unpredictable and uncertain, and it can be a really difficult roller coaster to cope with. So the symptoms outlined in this presentation today are commonly experienced by people who do have lung cancer, but it's certainly not an exhaustive list. So do keep in mind that every cancer experience is different, and your experience of these symptoms and their intensity and their duration will vary as well. So when we think about the physical symptoms from lung cancer itself, as well as treatment side effects, pain is a really common experience for people living with lung cancer. And identifying the source of pain can be challenging at times, as you may know or may not know, but it can be a challenging experience. So, is it from treatment? Is it from disease? Or is it completely unrelated to cancer? It's tricky to know sometimes. And cancer fatigue, it's different than just regularly being tired. Cancer fatigue is a form of exhaustion that can feel incredibly heavy and really energy zapping. And it's often caused actually by several factors like treatment from the disease itself, from various medications, from stress, and from more. The list is pretty long. And the other thing about cancer fatigue is that despite good rest that you may be getting, cancer fatigue can be really hard to treat, and it can feel frustrating and of course greatly impact life as well. Another physical symptom is persistent coughing and shortness of breath, which are also very common experiences and can actually be caused by a few different things also, like the location of a tumor, perhaps, or from anemia or fluid buildup, just to name a few. Gastrointestinal issues, can also be a huge challenge that people experience. And lung cancer, the disease itself and treatment, can significantly impact appetite, digestion, as well as bowel and bladder movement. And again, can be very challenging and impact quality of life. And then brain fog, brain fog, also known as chemo brain, chemo fog, or cancer-related cognitive dysfunction, also a very common experience for people living with lung cancer. For some people, it can start at the beginning of diagnosis, and for many, it starts during or after treatment. For most people, brain fog symptoms eventually improve following treatment, but for some, those cognitive changes can linger for months and even years to follow and show up further down the road. The exact causes of brain fog are poorly understood, which make it really difficult sometimes to treat. So common causes are, lung cancer itself, treatment, infection, dehydration, depression, hormone changes, fatigue, pain. I mean, the list is kind of endless sometimes when it comes to brain fog. It's really hard to know, and there are no medical interventions that can help brain fog. However, symptoms can be managed with some specific strategies and behavior changes, which we'll talk about in a little bit. Mental and emotional health. Stress and anxiety are just so common when it comes to a cancer diagnosis, and it's a very normal response to life being turned upside down from a diagnosis. Stress is typically caused by external factors, so things that are outside of one's control, like a cancer diagnosis. And anxiety shows up as persistent and excessive worrying that may or may not be triggered by one of those external stressors. Sometimes I call anxiety or refer to it as kind of runaway worries. They're worries that are kind of always like outside of our grasp. It feels hard to get a hold of them. Anxiety can feel like that sometimes. And stress and anxiety can manifest in similar ways. So it can show up as insomnia, with difficulty concentrating, fatigue, irritability. The list really goes on. And over time, when stress and anxiety can't be avoided, like with cancer, because again, it's a very common response to a cancer diagnosis, stress and anxiety can really take a toll on physical and mental health, and that can further exacerbate depression, which is another common experience amongst people living with lung cancer. And studies have shown that diagnosis and impact of disease and symptom burden can actually increase risk for depression, which makes it really a common experience for people living with lung cancer. And another impact in terms of the mental and health or mental and emotional health perspective is, a sense of disconnection or isolation or loneliness. A lung cancer diagnosis can significantly impact a person's sense of self, their value and worth in life, their sense of belonging, as well as their sense of purpose and place in the world around them. So although lung cancer is the most diagnosed cancer in Canada, it can still feel like a very lonely and isolating experience. So if that's something that resonates with you, please know that you're not alone in that. And again, too, lung cancer changes many, if not all, aspects of life. There are many losses experienced with a lung cancer diagnosis. And for people living with the disease, as well as their loved ones, grief is a very common experience. When we think about the practical impact from lung cancer, some of the most challenging aspects to navigate, while simultaneously trying to manage physical and emotional side effects, are under this category of practical matters. So things like finances and work, cancer can take a big toll on finances, missed income, changes in savings or investments, adjustments to short and long-term plans, such as retirement, and even one's ability to pay monthly bills, including mortgages and other debt. Work might slow down or need to stop altogether, which decreases that monthly income. But, with cancer, expenses sometimes increase to compensate for additional needs. So this is a really tricky piece of a lung cancer experience, which is, related to finances and work. Regular household tasks can suddenly also become very overwhelming for people living with the disease and their loved ones as well. So add on any additional responsibilities like caring for other loved ones, children, elderly parents, pets, and life suddenly can feel like it's spinning out of control. And then one of the other common experiences under that practical category is transportation. So transportation to and from appointments when juggling other responsibilities as a care partner, or when feeling unwell, as a person living with lung cancer, this can be a huge barrier to receiving treatment and regular follow-up care. So again, when we think about the signs and symptoms, this is, again, not an exhaustive list, but it's certainly some of the most common experiences that people have. So when we think about some strategies to cope with all of these disease-related symptoms and treatment side effects, it can feel a bit like a puzzle sometimes when trying to kind of figure out how to put pieces together when everything's changing so quickly sometimes. And also when it's really difficult at times to pinpoint the cause of something. So many of the strategies that we're going to explore today can address multiple issues at once. And again, it's not an exhaustive list of strategies, but as always, please consult your oncologist or your healthcare team for appropriate guidance. And remember always to go at your own pace and to really do what works best for you. So when we think about some physical health strategies, physical ability will vary greatly depending on how you're feeling. So get creative and set a realistic goal for this moment in time right now. Maybe one moment or one day you're feeling like, you're able to kind of walk the aisles of the grocery store or even go for a long walk. But other days, moving from the bed to the bathroom perhaps seems nearly impossible. So modify your exercises to meet yourself wherever you're at. Even if you're stuck on the couch, stretching, muscle relaxation, light weightlifting, and other stationary exercises can be really important ways to engage with your physical body, regardless of whatever or however you're feeling. And there are also excellent cancer-related exercise programs available virtually that you can participate in. And one of those examples is the Excel program. Protecting your sleep. So, this is, these are all obvious things, I think, but sometimes just having that reminder and some kind of tips to, lean into some of these examples can be helpful. So again, a consistent sleep routine that's free from stimuli, including screens, caffeine, and alcohol, can really have a huge impact on quality and quantity of sleep. Meditation and relaxation exercises can also be helpful. And also research shows too that physical activity before bedtime, something like walking or yoga or a dance party, can be really helpful. Scheduling rest, that's another interesting thing too. So scheduling rest, even if it's many short breaks throughout the day, can be really helpful. And then also prioritizing your energy. So adjusting to your new normal and switching gears, yeah, it can definitely be challenging. But use your energy wisely. Use it for the things that bring the best quality of life to you. So when you think about, under the physical category and how appetite and taste can change, seeking good nutrition and consulting a dietitian can help to offer some new ideas or creative solutions to any food challenges that you might be experiencing. Dietitians are really helpful members of an oncology team, and they can offer nutrition information, recommendations for alternative nutrition supplements. They have excellent recipe ideas and more. In addition to seeking support from a dietitian, there are some additional strategies that you can engage with to help with the change or even loss of appetite, such as serving 6 to 8 snacks or small meals a day instead of 2 or 3 big ones. Serving food at different temperatures than you're used to. So maybe serving food at a cold or room temperature if the smell of food is unpleasant to you. Offering smoothies or milkshakes or other drinks like Booster and Sure instead of solid foods. And then offering, maybe eating with plastic forks and knives if metal flatware tastes bad for you. So those are just some kind of additional suggestions that can be helpful. Inquiring about additional supports like home oxygen if you're having some breathing issues, or home care, or home aids such as bath chairs, hospital beds, commodes, and more can also be really helpful. And when we think about brain fog, sharpening your mental ability can be really helpful. So repetition is key. So saying things quietly or out loud to yourself a few times over to just really kind of take that information in, or ask someone else to repeat themselves, that can be helpful to sharpen your mental ability. And then filter out information that you don't need and concentrate on information that you do need. So again, take what you need and leave the rest. Filter what you need and don't need. Using a diary or agenda to track daily activity can also be helpful. And tracking symptoms and side effects daily can be really helpful in trying to manage symptoms and side effects too. So use that diary to your advantage. Guided meditations for focusing can be extra helpful. And again, avoid multitasking. That can be tricky sometimes, especially when there's a lot of things on the go, but trying to focus on one thing at a time is helpful. And then lastly, in this category of physical health strategies, trying to maintain your lifestyle and participating in activities that are fun, enjoyable, and that add to your overall quality of life should absolutely be prioritized whenever possible. As difficult as it may feel to maintain these activities, dropping them on the wayside when you're in the thick of it can actually be counterproductive. So, you might not be up to playing pickleball anymore, or maybe chasing your kids or grandkids around, but simple things like singing along to a song in the car, cranking that up, watching a favorite show, or even, something as simple as reading daily jokes can lift the mood for even just a few minutes, which can make a big difference. Find things that bring you joy and focus on them. And, as important as it is to maintain structure and routine, be open to changing it also. Take it one day at a time and do what works best for you. So there are many evidence-based tools that can help to cope with the mental and emotional impact of cancer. The American Psychological Association suggests some of the following examples that I have listed up here, but again, it's not an exhaustive list. Identifying ways to reduce the stressors or stress is pretty hard to do in cancer is in the picture, so let's just be realistic about it. How much can you reduce the stress? So it's not about eliminating it altogether, because that's maybe not very realistic, but how much can you reduce that stress? So on a scale of 1 to 100, what level of stress are you at today? Are you at a 60, maybe 70, maybe even 80? How can we move that 80 down to 79 or 75 or maybe even 70? What meaningful actions can you take to adjust that barometer down a little bit? What's within your control to actually change? Engaging in social support networks. Studies show that strong social supports can help to build resilience to stress. So reach out strategically and connect with your network. Just like going to the gym or engaging in a physical activity builds muscle, engaging with your network of family and friends and community can actually help to build those resiliency muscles as well. But I also recognize that socializing can be hard. Socializing can be hard when you're not feeling well physically and or mentally. So be creative in how you connect. Maybe you're used to having coffee with friends once a week. Maybe it's having coffee over the phone or Zoom for 15 minutes. Be creative in how you're connecting with people. And identify the people who bring a sense of peace and calm and spend time with those people. So, the other interesting thing about engaging with your social support network, a lot of times, because of how cancer presents itself, patients living with lung cancer are on the receiving end of that support. But research shows us also that if you can give support to others, it's shown to increase positive emotions, including one's own sense of self-worth, your sense of belonging, and also just connecting with your loved ones and the world around you. So if you can be on that giving end of support, even in small ways, it can make a big difference. Practicing mindfulness and meditation is also really proven to be helpful in terms of a strategy for this category. So meditation has been practiced, as we know, for thousands of years, and it can be defined in many ways. But one way that I think about it is by training your attention to achieve a mental state of calm, concentration, and positive emotions. So I'll say that again. So meditation, you can think about it as a way to train your attention to really get to that state of calm and positive emotion and concentration. Mindfulness is a really popular technique that focuses on attention and acceptance. So there's a lot of research out there. There's a huge body of research actually that shows that mindfulness-based therapies are particularly effective for reducing stress and anxiety and depression for people living with cancer. So two mindfulness-based strategies include mindfulness-based stress reduction, MBSR, and then mindfulness-based cognitive therapy. So these two categories for people living with cancer are widely available online. They are also often available as programs in cancer centers. Sometimes yoga studios have different programs that are out there. So, if you're interested in this, certainly, do a quick search online, and I have no doubt that you'll find something that's a good fit for you. Getting outside, research also shows us that getting outside, it's no surprise, has a really positive impact on overall health and well-being. And if you can't get outside because of how you're feeling, bring nature to you. Open a window, maybe read some poetry or books about nature, watching nature videos. Time spent in nature or bringing nature to you can really help to ground the nervous system and to calm your mind. Prioritizing and organizing can really help you to get clear with what's really important in life, and shifting priorities accordingly and giving those priorities the most meaning and value can be helpful. So set aside or cancel anything that doesn't align with your core values and goals, and really hone in on what does matter. And communicating with loved ones, again, we know that lung cancer impacts relationships, but don't let that stop you from connecting with your loved ones. Share your thoughts and feelings with them. Communication can help to lower anxiety and fear that cancer can cause. Speaking to a counselor can also be very helpful, and they're available at cancer centers and also organizations like our organization, Lung Cancer Canada. That's a part of what I do in my role here. Joining a support group can also be a wonderful source of support and connection. And again, available through cancer centers and through organizations like LCC. So we have a patient support group that we run on a monthly basis. And we're also soon launching a care partner support program as well, or support group, I should say. And then, of course, talk to your doctor if you have any concerns. So if you recognize that your anxiety or depression symptoms are moderate to severe for any length of time, medication might be a helpful source of support for you. And there's lots of different medications out there, but talk to your doctor and see, what might be a good fit for you and when. When we think about practical strategies, the biggest piece of guidance that I hear from others that I want to pass along today, and which research really supports, is to seek support. So seeking support from a financial advisor or your banking and financial institutions, including credit card companies, can be helpful. If you have pensions or retirement savings or insurance plans, contact those companies or policyholders to see if any additional safeguards or income might be available to you at this time. And again, going back to that communication piece, share your concerns with your loved ones. Two hats are always better than one when it comes to problem solving, so you don't have to go it alone. Consider alternative sources of support, such as meal trains, transportation schedules, additional childcare, or care for other loved ones in your family. And then also connecting with patient and family supports at your cancer center. Your local, social workers and other clinicians might have additional knowledge of resources that are available to you in your local community. So definitely reach out to them. And then they can also help to navigate other practical matters, including short and long-term disability and other practical things. So in summary, again, we've said it many times, and we know this to be true, that lung cancer as a disease, as well as subsequent treatments, can cause significant symptoms and side effects, and it really can impact all parts of life, not just for people living with the disease, but for their loved ones as well. There are many ways in which symptoms can be managed, and again, this is not an exhaustive list that we've talked about today. Changes to your lifestyle and strategies to relieve the symptoms and address those unmet needs can all help to minimize the effect of the symptoms on your overall health and quality of life. And again, as I've said, you're definitely not alone in this journey, in whatever hat you're wearing or role that you're playing. You don't have to go it alone. Seek support from your healthcare team so they can work with you to find the best path forward. Keep them up to date and informed about any changes or symptoms you might be experiencing. And again, talk to a counselor, join a support group, or reach out to support from your loved ones. The better your symptom management, the better your quality of life and treatment outcomes will be. Again, if you have any questions at all or would like some additional support, please don't hesitate to reach out to myself, to my colleague Michelle, or to anybody else from our organization. We are just so thankful that you've joined us today, and stay tuned to our Lung Cancer Canada website for news of our upcoming webinar this fall.